is the Seclusion and Restraint debate for self-injurious behaviors and aggression. My name is Chloe Mossman, and my other group members are...
I'm Brienne Ellis.
I'm Erica Boreski.
And Tracy Holton.
So now that you know who all of us are, we'll go ahead and get underway. Individuals with autism and other developmental disabilities who engage in severe aggressive behavior and self-injurious behaviors can pose significant threats to themselves, peers, and staff, teachers, or parents who work with them. The Ethical Code promotes the use of the least restrictive procedures. However, those providing services to individuals with severe problem behavior may consider the use of restraints and/or seclusion, stating these are necessary to prevent severe self-harm or harm to others. We explored this topic researching the history and pros and cons of using restraints and seclusion as the behavior intervention techniques. Brienne and Erica are arguing for the use of seclusion and restraints. Myself and Tracy are arguing against the use of seclusion and restraints. So we'll now open our debate with Brienne introducing the arguments supporting restraints and seclusion.
Thank you. If a behavioral intervention has not been successful in reducing self-injurious behavior or physical aggression, how can the client be protected and the professionals that serve them? History has shown us that seclusion and restraints have often been misused, and clients have ended up abused and mistreated. However, we can keep from making many of these same mistakes by putting boundaries in place and by including the clients as part of the conversation. In a study by Powell, he suggested that the clients be asked whether or not they want to be secluded or restrained, or in some instances given medication, and letting them be a part of the decision of how to handle some of their aggression and self-injurious behaviors. We're also for the use of seclusion and restraints in order to protect the professionals who serve these kids from the physical aggression. We believe that seclusion and restraints can be an effective way to assist clients in calming down when their actions pose imminent danger to themselves and others. In a study by Mariu Coate, he reported that the majority of his participants reported that being restricted helped them calm down. We'll now go over to Chloe for the con statement.
Furthermore, there continues to be no evidence that using restraint or seclusion is effective in reducing the occurrence of problem behaviors that frequently precipitate the use of such techniques. The former Secretary of Education, Arne Duncan, said this statement regarding the proven ineffectiveness of restraints and seclusion for self-injurious behaviors and aggression. If restraints and seclusion are not reducing problematic behaviors, then who's benefiting from their use? The use of restraints and seclusion is extremely risky and creates many opportunities for human error, resulting in the infringement of clients' rights and harm. Overall, the legislation and guidelines overseeing the use of these techniques is ambiguous and poorly regulated and often violates ethical codes for behavior analysts. Further, these techniques are dangerous and may result in the harm or death of clients and/or the staff members implementing them. And finally, you'll see there are many positive alternatives other than punishment and restraint that are commonly not exhausted before restrictive techniques are implemented. These techniques prove to be more successful long-term and are associated with much lower risk. Tracy and I are against the use of restraints and seclusion. We believe the use of seclusion and restraints is a dangerous practice, creating legal and ethical infractions. Now, with both sides having stated their perspectives, we'll move into Erica presenting the research supporting seclusion and restraints.
Thank you, Chloe. What is restraint? To restrain is to involve preventing someone from doing, exhibiting, or expressing something, and extraining means limiting, restricting, or keeping under control. This is from Restraint 2009. In human services, the term restraint is used with 3 different types of restraint procedures. 1 is a mechanical restraint, 2 is a chemical restraint, and 3 is a physical restraint. The Council for Children with Behavioral Disorders, the CCBD, this is from their Physical Restraint Article 2009. The purpose of physical restraint is to control the behavior of a student in an emergency situation to prevent immediate danger or possible injuries to that student or others. While preventing property damage is sometimes included as a purpose for physical restraint, Most professionals do not include that as a legitimate purpose for these procedures. The CCBD's Physical Restraint 2009 says that it's only meant for situations of emergency use. The use of physical restraint has been applied to children with emotional disturbances since the 1950s, and it was included in the list of techniques for the antiseptic manipulation of surface behavior, which was compiled by Rettel and Weinman in 1952. Rettel and Weinman stated that a child's loss of control should be viewed as an emergency situation in which the educator or clinician should either remove himself or others, herself or others. The person performing the restraint should then remain calm, friendly, and affectionate while attempting to maintain a positive relationship with the child. Thereby, this provides the opportunity for therapeutic progress once the child's crisis subsides. And that is also from Ryan 2004. For physical restraint to be used effectively, it is essential that the behavioral interventions which might prevent the need for restraint are in place as well. Included establishing and teaching behavioral expectations, which means acknowledging that for many students this may require deliberate, targeted instruction in which the behavioral expectations mean, since being able to repeat the expectations does not always necessarily guarantee the child understands them, as we know through our ABA therapies. We also need to recognize and reinforce positive behavior, providing mental health services and interventions, and relying on functional behavior assessment and related intervention plans for any student whose behavior indicates a need for this type of intervention. Lack of resources to provide appropriate kinds of services are never an excuse to employ restraint or procedures. Without positive behavior support, the number of emergency situations which might require restraint would be much greater than would otherwise be necessary otherwise. And that is from, again, the CCBD's Physical Restraint 2009. Seclusion is the involuntary confinement of a student alone in a room or area from which the student is physically prevented from leaving. This includes situations where a door is locked, as where the door is blocked by another object or could be held by staff. Anytime a student is involuntarily alone in a room and prevented from leaving, this should be considered seclusion, regardless of the intention or purpose or the name applied to the procedure or name of place where the student is secluded. And this is from the CCBD's Seclusion paper 2009. Although it's commonly used for a variety of purposes, most professionals believe that seclusion is warranted only when a student's behavior is so far out of control or so dangerous that the student's behavior in the current environment poses a risk of injury to the student or others. Again, from CCBD's Seclusion 2009. Seclusion should only rarely be used in school settings. Seclusion should not be viewed exclusively as an issue related to special education, as it is likely that this could be an exclusion employed in school settings with some students who are not in special education as well. Therefore, the regulations or guidelines and procedures, these should all apply to all students in any school situation, not just those with disabilities. This is again from the CCBD's Seclusion paper 2009. From this information, we believe the use of restraint should still be an available option in case of a positive behavior support failure. According to the Behavior Code 2.0, the behavior analyst has responsibility to the client to provide service and do no harm, including protecting the client from harm if they may self-inflict or cause others. It's only in these types of situations why the use of restraint and seclusion may be necessary. And now, Tracy, please present the arguments against seclusion and restraint.
Thank you. I'm going to present data to support our three main points: ethical violations and lack of legal guidelines, risk of significant harm to clients and staff when using seclusion and restraint, and positive interventions are not delivered with fidelity. Using restraint and seclusion as interventions to address physical aggression and self-injurious behaviors are violating ethical and often legal regulations. The BACB ethical guidelines are already clearly addressing seclusion and restraint. Code 209, treatment intervention, addresses the fact that in order to use seclusion and restraint, Those techniques would have to be determined to be an effective intervention for the short and long term. Code 408, considerations regarding punishment procedures. And Code 7.02, ethical violations by others and risk of harm, implies that since there is an obvious risk of harm or possible legal violation, seclusion and restraint is not ethical. Sorry. Okay. State and federal regulations are varied, unclear, and leave plenty of room for interpretation. According to the 2010 report of Seclusion and Restraint, statutes, regulations, and policies, and guidance by state and territories, there were 19 states that did not have state statutes or regulations addressing seclusion and restraint. States vary widely in their regulations regarding protections of individuals. When these methods are allowed, legal definitions and regulations of seclusion and restraint, notifications, and data collection. That was from Butler, 2014. Just for an example, the state of Indiana has no statewide policy for the use of seclusion and restraint. Indiana code does require schools to develop written rules of discipline and recommendations for what to include in their guidelines. Point 2, many incidences of great harm and even death result from these procedures. As you can see here in the pictures, many times seclusion and restraint are used in very dangerous methods. Risk of harm or death is evident by the study completed in May 2009 by the Government Accountability Office. The investigative branch of Congress completed a study in May 2009, sharing the findings of death and abuse as a result of seclusion and restraint at public and private schools or treatment centers. They reviewed 10 restraint and seclusion cases in which there was a criminal conviction, a finding of civil or administrative liability, or a large financial settlement. They found that children were at higher risk of seclusion and restraint, and these practices can be extremely dangerous as they coincide with physical struggling, pressure on the chest, and other restrictions of normal breathing. In several incidences, staff used unsafe restraint techniques that resulted in death or abuse. In the 10 cases examined, the following were common characteristics. Children with disabilities were sometimes restrained and secluded even when they did not appear to be physically aggressive, and their parents did not give consent. Face down or other restraints that block air to the lungs can be deadly. Teachers and staff in these cases were also often not trained in the use of restraints and techniques, and teachers and staff from these cases continue to be employed as educators. In addition, there were hundreds of allegations of face-down restraints or restriction of airway, 20 of which resulted in death. Untrained staff continue to be employed in our systems today. Currently, there are many drafts and advisements on this issue, but at this time, the federal government is leaving decisions to the individual states, which means lack of plans and accountability. Stated in the report by Christine Nishimura, teachers believe restraint is necessary to protect the student from harming themselves or others. However, often it is to only protect damage to property. In school settings, seclusion is often used as a consequence for inappropriate behavior in an attempt to change the behavior. Educators continue to be resistant to limitations being placed on their ability to restrain and seclude students. While there are no studies on the benefits of seclusion and restraint, there is information that students spend excessive and unnecessary time in seclusion. According to a study conducted by the Council of Parent Attorneys and Advocates, 71% of the 185 cases studied did not use any form of positive behavioral supports as an intervention. Students interviewed after occurrences of seclusion and restraint also reported emotional trauma such as anxiety, mistrust, depression, embarrassment, and anger, to name a few. Physical injury is also often a result of restraint and seclusion, such as bruises, bleeding, scratches, and even broken bones. As you can see in this chart, this chart shows the most common types of restraint is reported as the prone position, which is also the most dangerous. Positive techniques and training to reduce harm produce greater positive outcomes. PBIS seeks to value the rights of individuals and implement scientific problem solving to address the learning and behavioral needs. The key features of PBIS, as identified by a pioneer in the field, include a prevention-focused continuum of support, proactive instructional approaches to teaching and improving social behaviors, conceptually sound and empirically validated practices, systems change to support effective practices, and data-based decision-making. When practices such as nonviolent crisis prevention intervention are implemented, the need for restraint is significantly reduced. Seclusion and restraint have not been proven to be effective at reducing future incidents of the risk of harm and does not outweigh any potential benefit. Now, hearing both sides presented their point of view, we will open the floor for questioning with Erica beginning.
Thank you, Tracy. One of my questions is there any level of escalation the con side feels it would be appropriate to include restraint or seclusion during treatment? Well, I found multiple different places that were supporting a type of training for the violent or for behavior that might occur. So professional training programs are put into place to assure protections are put into place appropriately. Most of these programs evolve from training programs for staff at residential treatments in psychiatric facilities from psychiatric hospitals. But these organizations now offer their extensive training programs to various agencies, including schools. After initial training, they provide recurrent training and sometimes through a local person certified in that particular program. And this is from Ryan 2004. In most medical and psychiatric and law enforcement applications, strict standards have to govern these physical restraints and seclusions. Hospitals and treatment centers, which receive federal funds from the U.S., are governed by federal legislation regulating their use of restraint. Other accreditation requirements from the governing bodies, such as the Joint Commission on the Accreditation of Healthcare Organization or other agencies, such as the National Association of Psychiatric Treatment Centers for Children, this is from Kuribari 1996, and the American Academy of Pediatrics 1997. They both address these types of restraints. These requirements have resulted in widespread training and certification of staff in the medical and psychiatric programs that employ physical restraints, and that is from the CCBD's Physical Restraint 2009. According to the U.S. Department of Education Restraint and Seclusion Resource Document, in cases where a student has a history of dangerous behavior for which the restraint or seclusion was considered or used, a school should have a plan for 1, teaching and supporting a more appropriate behavior, 2, determining positive methods to prevent behavioral escalations that have previously resulted in the use of restraint or seclusion. The department has also identified 15 principles that we believe, and they state that schools, states, preschools, elementary, secondary schools, parents, and other stakeholders should consider as framework for when the states, localities, and the districts develop and implement policies and procedures, which should be in writing related to restraining and seclusion to ensure that any of these restraints or seclusions in school do not occur, except when there is threat of imminent danger that can seriously that can create serious physical harm to the student or others and occurs in a manner that protects the safety of all involved children and adults in the school. The 15 principles are as follows. Every effort should be made to prevent the need for the use of restraint and the use of seclusion. Schools should never use mechanical restraints to restrict a child's freedom of movement, and schools should never use a drug or medication to control behavior or restrict freedom of movement, except as authorized by a licensed physician or qualified health professional. Physical restraints or seclusion should not be used except in situations where a child's behavior poses imminent danger or serious physical harm to himself or others. Number 4, the policies restricting the use of restraint and seclusion should apply to all children and not just children with disabilities. 5, any behavioral intervention that may be consistent with the child's rights needs to be treated with dignity and free from abuse. 6, restraint or seclusion should never be used as punishment or discipline or put as a mean as coercion or retaliation or just as a convenience. 7, restraint or seclusion should never be used in a manner that restricts a child's breathing or harms a child. 8, the use of restraint or seclusion, particularly when there is repeated use for an individual's child, this is with multiple uses within the same classroom or multiple uses with the same individual, this should trigger a review and, if appropriate, revision of strategies currently in place to address dangerous behavior, and if positive behavioral strategies are not in place, staff should consider developing them. 9, behavioral strategies to address dangerous behavior that results in the use of restraint or seclusion should address the underlying cause or purpose of the dangerous behavior. 10, teachers and other personnel should be trained regularly on the appropriate use of the effective alternatives to physical restraint and seclusion, such as a positive behavioral intervention and supports, and only for cases involving imminent danger of serious physical harm, on the safe use of physical restraint and seclusion. 11, every instance in which restraint or seclusion is used, it should be carefully and continuously and visually monitored to ensure the appropriateness of its use and safety for the child, other children, teachers, and other personnel involved. 12, parents should be informed of the policies on restraint and seclusion at their child's school or other educational setting, as well as applicable federal, state, or local laws. 13, parents should be notified as soon as possible following each instance in which restraint or seclusion was used with their child. 14, policies regarding the use of restraint and seclusion should be reviewed regularly and updated as appropriate. And finally, 15, policies regarding these uses of restraint and seclusion should provide that each student or each incident involving the use of restraint or seclusion should be documented in writing and provide for the collection of specific data that would enable teachers, staff, and other personnel to understand and implement these preceding principles. Those are the 15. And now I'm going to send this over to Chloe for her question.
Thank you, Erica. So I have one question to respond to, and that is there any level of escalation the con side feels it'd be appropriate to include restraint or seclusion during treatment? As we stated earlier, there are just too many unregulated variables that create too great of a risk to use restraint or seclusion. Currently, every state is able to make its own regulation with no standard set or upheld federally, allowing every client to face different interventions for a similar behavior across the country. Until there are federal standards set, there is no way that restraint or seclusion can be employed fairly for all individuals. There are procedures outlined in most physical intervention strategies that involve blocking and avoidance techniques that are equally effective and do not involve restraint or seclusion. Restraint avoidance techniques are less dangerous and effective in de-escalating crisis situations, and while still protecting everybody involved in those situations. So we will now move into closing statements.
Although there is danger to using seclusion and restraints, this must also be weighed against the imminent danger that can occur from self-injurious behavior and physical aggression if seclusion and restraints are not used. Positive behavior support plans are excellent things and great proactive approaches, but all too often the situation becomes too escalated beyond the point of a support plan being able to help, and then action needs to be taken to ensure the safety of the client and of the professionals that serve them. It's important to respect a client's rights, but it's also important to respect the right to safety of the individuals that serve the client. We recommend knowing the proper ways to implement restraints so as to not impede breathing and to have boundaries for seclusion that is approved by the client and their guardians before providing services. And I'll hand it over to Tracy for the closing statement.
Thank you, Brianne. Restraint is used excessively with children and with those that are not displaying physically aggressive behaviors. Staff lack proper training and support to implement proper use of seclusion and restraint. According to the GAO report, at least half of the teachers involved with restraint and seclusion that resulted in death or serious injury continue with their educational careers. Inadequate state laws and protection of school systems and staff. Additionally, oversight and regulations have not been passed that would protect individuals from unnecessary harm and require schools and programs to report their data regarding the use of such measures and their outcomes. By eliminating the use of seclusion and restraint, staff will be forced to implement positive and proactive techniques that directly address the individual educational and functional needs, and therefore reducing the need for such aversive methods. The use of seclusion and restraint are only causing emotional and physical harm to students. Implementing positive behavior support plans to teach students to manage their behaviors appropriately is best practice. We have some additional questions, and Erica will be reading the first one.
Thank you, Tracy. Our first question is, what we have is, how does one weigh the potential for restraint to prevent harm to the individual engaging in unsafe behavior towards themselves and those around them against the potential for harm as a result of restraint, physical or otherwise? Everyone works. When the client is engaging in an unsafe behavior towards themselves or others, the path that will allow the least amount of physical or emotional damage should be taken. As in Ethics Code 2.05, the client's right should be upheld, and they have a right to safety and to being unrestrained or secluded. However, behavior analysts are also held to Ethics Code 4.10, avoiding harmful reinforcers. Self-injurious behavior and aggression towards others has a function, and it can be reinforced if not dealt with properly. Anything that reinforces the function of any type of aggression can be considered harmful reinforcer and should not be used. If physical or emotional damage is imminent, then the least harmful path should be chosen. The training and qualification of staff must also be considered when weighing the option to use restraint, to use it or not to restrain. To adhere to Ethics Code 1.02 and 1.03, boundaries of competence must be acknowledged as well. Only those certified to train in restraint and seclusion techniques are qualified to implement and train others in restraint and seclusion. Furthermore, once these staff have been trained, then the skills must be maintained and competence must be assessed on a regular basis. These responsibilities must be recognized and considered when discussing the possible implementation of restraints or seclusions. Now it looks like we've got more questions coming in. Tracy, I think this one's for you.
Yes, thank you. How might one set guidelines to help staff determine the cost benefit in situations in the moment? I was researching this the other day, and I did find a lot of patient care standards documents, including some decision trees. So I feel a school or agency should develop or use a decision tree similar to this one. Oops. To determine if seclusion and restraint is necessary in a crisis moment. If risk or death or serious injury is likely, seclusion and restraint methods may be necessary. It is essential that staff involved in aversive techniques are trained properly and maintain training license requirements. Staff must be familiar with and demonstrate their knowledge of state and federal regulations regarding management of behaviors, including seclusion and restraint. We have another question.
Yes, I have the next one. And this question is the use of restraints and seclusion ethical, and what does the literature and ethical code indicate? The code does not specifically state whether seclusion and restraints is an okay practice, but it does give us a little bit of guidelines, and it always emphasizes maintaining clients' rights and dignity. The first code that I found was 4.02, which is involving clients in planning and consent. And as mentioned earlier, it's important to involve the clients on whether or not they would want seclusion or restraint as part of their program when they are capable of being a part of that conversation. Another code was 4.08, considerations regarding punishment procedures. Seclusion and restraint should never be the first intervention that's used when clients become aggressive or perform SIB. That's in compliance with 4.09, least restrictive procedures. But when other de-escalation methods are not working, seclusion can be used and restraints with careful oversight and to go back and then look at those situations where it has been used and evaluate what you could do differently and how you could prevent having to use seclusion or restraint in the future. It says that restraint should be used in school settings only when there's imminent danger and to themselves or to other students, and that's from the U.S. Department of Education. And now we'll go to Chloe for the last question.
Yes, I have the fourth and final question, and that is, what role should a behavior analyst play in interventions involving restraint and seclusion? The ethics code states that behavior analysts are in charge of the behavior change program in its entirety, from beginning to end, in ethical code 4.0. And therefore, behavior analysts may recommend the use of restraint and seclusion. However, in doing so, this recommendation can only be made after all other positive interventions have been exhausted. If using restraint and seclusion, the behavior analyst has now taken on a great responsibility. Reinforcers for alternative behaviors must be incorporated into the behavior change program. The behavior analyst ensures that increased training, supervision, and oversight occurs while these techniques are being used. And the behavior analyst must ensure that the effectiveness of these techniques is measured shortly after implementation and is in charge of discontinuing them if ineffective or no longer necessary. So overall, behavior analysts do not make a recommendation for a restraining or seclusive intervention and then back away from the situation. It's a behavior analyst's responsibility to ensure that the restriction is implemented properly and is effective. So that concludes our debate, and thank you so much for watching.